Take 1. Anti-psychiatry in simple steps. 1. Doubt diagnosis. Anti-psychiatry questions the accuracy and validity of psychiatric diagnoses, suggesting that they often oversimplify complex human experiences and behaviors. For example, what may be considered abnormal in one culture or context might be normal in another. 2. Critique treatment. It critiques traditional psychiatric treatments like medication and electroconvulsive therapy, arguing they can be harmful and suppressive rather than genuinely therapeutic. Critics argue that psychiatric drugs can have severe side effects and may not address the underlying causes of mental distress. 3. Power dynamics. Anti-psychiatry highlights power imbalances within psychiatric institutions, where professionals hold significant authority over patients' lives and decisions. This imbalance can lead to coercion, involuntary treatment, and the violation of patients' rights. 4. Advocate alternatives. It advocates for alternative approaches to mental health care, such as psychotherapy, peer support networks, and community-based interventions. These approaches focus on empowering individuals and addressing social and environmental factors contributing to mental distress. 5. Human rights. At its core, anti-psychiatry is concerned with human rights issues, including informed consent, involuntary treatment, and the rights of individuals labeled with mental disorders. It emphasizes the importance of respecting individuals' autonomy and dignity in the treatment of mental health issues. 6. Ongoing debate. While controversial, anti-psychiatry has sparked ongoing debates about the nature of mental illness, the role of psychiatric institutions, and the need for more holistic and humane approaches to mental health care. It encourages critical reflection on existing practices and the exploration of new ways to support individuals experiencing mental distress. Take 2. Anti-psychiatry in simple steps. 1. Origin. Anti-psychiatry emerged in the 1960s as a response to perceived abuses and limitations of traditional psychiatric treatments, such as electroconvulsive therapy and psychotropic medications. Influential figures like R.D. Laing and Thomas Szasz challenged mainstream psychiatric practices and ideologies. 2. Critiques. It criticizes psychiatric labeling and diagnosis, arguing that they often pathologize normal human experiences and emotions. This critique raises questions about the subjective nature of psychiatric diagnoses and the potential for misuse or overuse of diagnostic categories. 3. Alternative perspectives. Anti-psychiatry proponents advocate for alternative approaches to mental health care, such as psychotherapy, community support, and social reform to address underlying societal issues contributing to mental distress. These approaches prioritize individual autonomy, empowerment, and social justice. 4. Survivor movement. A subset of the anti-psychiatry movement is the survivor movement, led by individuals who have experienced psychiatric treatment. An advocate for patient rights, informed consent, and alternatives to traditional psychiatric interventions. This movement highlights the voices and experiences of those who have been marginalized or harmed by psychiatric practices. 5. Controversy. Anti-psychiatry remains controversial, with critics arguing that it undermines the legitimacy of psychiatric diagnoses and treatments, potentially discouraging individuals from seeking help for mental health issues. Proponents, however, argue that it is necessary to challenge oppressive systems and promote more humane and compassionate approaches to mental health care. 6. Evolution. While the term anti-psychiatry may not be as commonly used today, many of its critiques have influenced contemporary debates within mental health care, including calls for more patient-centered approaches and greater transparency in psychiatric practice. By continuing to question established norms and advocate for systemic change, anti-psychiatry has left a lasting impact on the field of mental health.